One of the things that's trending is that they've increased tariffs by 120%. There are many interpretations being put on it for National Health Insurance Scheme. Exactly what are they proposing? Is being proposed by the ministry? Thank you very much for your time. Good morning to you.
Good morning, Sana.
I hope
How
you're
is
well.
life?
Yeah, we're fine, and I hope you are well too.
By grace, I'm good.
Okay, so explain to us this increase in tariffs. Exactly what does that mean?
Thank you. So that we have uncapped national health insurance to include a lot of things. One, to make sure that we pay promptly claims to our healthcare providers. We've uncapped to make sure that non-communicable diseases are catered for under the Ghana Medical Trust Fund, the Mahama Cares. We've uncapped to make sure that we have free primary health care for the people of this country. You also know that currently a lot of funding have dwindled or have been withdrawn. US aid is no more, other funds are no more, which means that we need to domestically look for funding to complement what we want to do. Our survey reveals that about 4,000 deaths annually are contributed or is as a result of the non-communicable diseases we have. We've also noticed that preventive and promotive health care has gone down and want to bring them back. All of these things are catered for by the National Health Insurance Scheme. And where the scheme is, we need some small amount to top up what we have to be able to do all of these things. That is why we are proposing for the upward adjustment of the tariff.
And the tariffs, when you say tariffs, is it for the person who goes to the hospital, or how would it apply?
Yes, so that is one of the things we are currently discussing. This will look at where it's coming from, whether it is actually at the facility level, the taxes claim to make room for some of the things we want to do. So this is just to look at what we want to do. There is a hint that we need these resources to do what we are doing. But as to what we want to do, we are going into the nitty-gritties and we'll share that with the people of this
country. And going back to it again, are you increasing the money you are paying to the facilities, or you're increasing the money that's charged to someone who goes to renew their National Health Insurance Scheme?
You know, most of the hospitals are currently saying that the money we pay, but over time, a lot of things have gone up. So they want us to increase. Now we do prompt payment. However, it's not meeting some of the things they have done. So they are requesting that there is some upward adjustment in that area.
And so that is what you are proposing to increase by 120%.
Exactly.
Okay. The question is where the money will come from to cater for that increase.
Exactly.
And where you're having, so the proposals on the table could either be partly the person who is, I don't know whether I call him the client, or it will go to taxes, or government will have to make up for the shortfall.
All of these things are currently being discussed. You remember that apart from the things I've mentioned, the Mahama Care, the free primary health care, the USAID, the removal of funds is also being catered for in the National Health Insurance Fund. So there are a lot of things that are now being catered for. What is more important is what we are currently doing. In the past, when the health insurance was capped, the influx were actually going to other sectors, not in the health sector. But on capping, we are reinvesting whatever is coming back into the health sector. You remember the recent sovereignty summit here in Ghana, where we had another outside the country, which was also attended by the president and the health ministers in Africa. The most important topic for discussion is these funds we are not getting to actually do the things we want to do. You know, there is this Abuja declaration that 15% of national budget should be dedicated to health. We have not gotten there. Thankfully, 2026 budget is giving us about 9 to 11% increment. So we are getting there. We need a lot of money to provide quality health care to the people of this country.
And those are discussions that are still happening. Have you gotten to the point where has what they famously called, is it Mahama Cares? Has it started operations yet?
Yes. The enabling act, has been put in place. The office has been established. The board of directors have been actually put in place. They have started operation. Their first case, if I recall, was a brain tumor they assisted to deal with. So there are a lot of things they are currently doing. They are currently doing a lot of advocacy, going around the country, visiting corporate bodies, making sure that they get buy-in from corporate Ghana. So a lot is happening there as we speak.
And I also realized the minister is, and to conclude on this, the minister is also giving an ultimatum to doctors who have been posted or medical officers who have been posted who have not reported to their posts. Exactly what is happening.
Chana, we opened the portal for about 700 doctors to accept posting to where we want them to go. So we opened the portal and actually get the regions that we needed on the portal. They went on, they get themselves posted to these districts and regions. The minister himself went to Savannah region, met the regional minister, MMDCs, to get them to prepare accommodation for the doctors who will be coming. He wanted to do all these new regions to get a regional minister, the health directorate, and the MCs, and then the MPs from there to get accommodation. If possible, get some vehicle to attract and retain. Because he saw this coming, that they may be posted and may not accept posting to these areas. And somebody who has worked as a ranking member is also aware that some of them will give excuses of accommodation. So he did the groundwork before the posting. But we still have some of them not accepting posting. So we have pleaded with them to use this 1 week period to accept postings. According to him, this is not punishment. This is what we call redistribution or equitable distribution of the health force or the health workers we have. Because most district hospitals do not have medical officers. Some of them, just one, others do not have at all. And he has a vision of making sure that every district has 2 or 3 medical officers providing health care to these districts. So that is where we are. So he's making sure that we get them. So the ultimatum is to just get them to accept posting within each period.
I see. How widespread is it? Because you're talking about 700 doctors.
But as we speak, about 50% of the medical officers or doctors we've trained in Ghana are in Accra and Kumasi, Konfanoche and Kolibu, which means that they are not in Ghana Health Service. Ghana Health Service is in the district and in also the regional capital. They want medical officers in their district hospitals. They don't have. Chad want medical officers in their district hospitals. They don't have. So this is a call for us to do good to the people of this country at this time.
Well, Tony, thank you. Thank you very much for speaking to us.
I'm grateful, my brother.
He's acting head of health training institutions, spokesperson for the Ministry of Health, joining us on the line. And one other thing to just draw attention to